I have approximately 33 wounds.
It was a left rotator cuff repair.
When I first got my wound, I fell off a step stool.
It started off
By
with
doing so,
a small sore.
It just started as a tiny little, little scratch.
I've had wounds for about 25 years that started for no apparent reason.
And it's a bone infection. It's actually an infection that eats away at the bone.
Several years ago, my legs started to swell.
I received an abrasion or cut in the middle of my shin, and it didn't heal.
The reason I first went to Dr. Sybil was because I fell up at Georgian Bay on the rocks. I had 2 falls, and of course both legs were affected. I had bandages almost from the ankle to my knees, and this was for me a very important part of what Dr. Sybil was looking after. And I don't think I'd be walking the way I am if it hadn't been for his knowledge and his contribution.
Wound care specialists are among the most needed professionals in healthcare today. Many wound care patients lack full and adequate coordinated care. The healthcare industry must seek to avoid working in isolation and strive to bring overall value to the patient by working in an interprofessional manner. Dr. Gary Sibbald, professor of medicine and public health at the University of Toronto, is making strides in this direction in the area of foot ulcers and wound care, where many of his patients' troubles are exacerbated and complicated by diabetes. Chronic foot wounds, especially when complicated by diabetes, affect so many people worldwide, and many have undetected vascular disease or deep infection.
They did not send in the wound care nurses. They just told the nurses on the floor to bandage it. They had no idea how to do it. They'd never done it before. I had to teach them.
and they're supposed to know more than me about how my wound should work and should not work.
I asked about a wound care because I'd heard about wound care nurses and I was told that it wasn't necessary.
They really didn't take it seriously. And we had to really push and push and push. And we went to, ER after ER visit. And to no avail, we just weren't getting anywhere.
In response to the need for wound care education for healthcare practitioners, Dr. Sibbald initiated the first IIWCC in 1999. The IIWCC, International Interprofessional Wound Care Course, is a continuing education certificate of completion and is a model for interprofessional care. The IIWCC has run continually in Toronto since 1999, and then was introduced in turn to Iran, Saudi Arabia, South Africa, the United Arab Emirates, and most recently in New York. 2/3 of Canadians in the University of Toronto course are Ontario-based. 1/3 is from the rest of Canada, with up to 10% international students. This progressive course focuses on the need for more professional passion surrounding wound care and foot ulcers, so afflicted patients have some hope of recovery, and preventative measures are taken to reduce numbers.
The International Interprofessional Wound Care course is a 9 to 12-month-long course at the University of Toronto. It features a certificate of completion rather than attendance, and it can also be part of a Master's of Science in Community Health, Prevention and Wound Care.
The course provides comprehensive educational experience for wound care specialists and seeks to translate new knowledge into practice. Hundreds of healthcare professionals working at all levels have been educated and can now offer crucial services to thousands of patients, if not hundreds of thousands, in dire need of their expertise.
I was part of the first class. It has made a significant difference in my life and in my career. It helped me to understand the research and the reasons why we do what we do, so it gave me that grounding to move forward and provide better care.
I get to work in an interprofessional team because I'm able to have the help and assistance of the doctors who treat wounds as well. And so that way I'm not working in a silo, I'm actually working with the team.
I'm a director of the Ministry of Health, Standards and Technical Services, Guyana.
I'm a specialist in dermatology, and right now I'm the medical director of the Southern Alberta Wound Care Clinic.
I'm an occupational therapist with Capital District Health Authority in Halifax, Nova Scotia.
I'm from Ottawa. I work on a medical surgical floor. Besides that, I also work in a long-term care facility.
I provide practice support and education for home and community care staff.
I'm a registered nurse in a dialysis unit in Winnipeg, Manitoba, Canada.
I'm a registered practical nurse. I'm employed at the Ottawa Hospital in Ottawa, Ontario.
I'm a registered nurse in community nursing. I'm from Williams Lake, BC.
I'm a registered nurse working in long-term care in Milton, Ontario.
Registered nurse.
I'm an infectious disease fellow from Calgary, Alberta. I think a multidisciplinary care approach model has to be implemented for success. So it's been implemented, in the HIV world and the hepatitis world and TB. And so I think wound care is one of those areas that is a growing need.
When you're the one wound care nerd in the group, you do feel alone, and yet here there's a whole bunch of us and we all learn from each other, and it's a good networking opportunity.
I do plan on putting on some educational sessions. The occupational therapists whom I work with are anxious to learn more about what I've been learning here, and I hope to engage a greater interdisciplinary team so that we can work better based on the guidelines and principles that I've learned through the IIWCC.
I really like the case studies because a lot of the times we're so able to relate those to our patients in Ottawa for sure.
We have very few clinicians who have advanced training in wound care, so this is definitely a need within our community. And as a part of the course, I've actually created a community of practice of wound resource nurses for all 16 health units.
I can now be better informed to develop policies, to guide the development of practices, so that my colleagues in various institutions nationally can start adopting best practices. And that way, we can see a national reduction in some of the morbidity caused by wound care, ulcers, various chronic ulcers, etc.
I can't stress enough that this is not a specialty that any one person can do on their own or in isolation. There are too many parts to this whole. It's not a particular specialty that's owned by any discipline. It's a little bit of medicine, it's a little bit of surgery, a little bit of orthopedics, a little bit of dermatology. And so being able to work with all those groups in terms of trying to make our patients' wounds heal has been a huge, huge bonus for me.
By drawing on the skills of a range of professionals, common goals can be achieved, and policymakers in Ontario are beginning to recognize the fiscal benefit, to say nothing of the added value to patients. Wound care makes up 40 to 60% of all home care visits. Establishing a system of interprofessional care gives the advantage of drawing on the skills of 4 or 5 healthcare providers instead of just one experienced provider, giving patients over a century of expertise, plus diverse styles and approaches. When this comes together well, the combined effort changes lives.
We are not doing as good a job as we need to do to educate healthcare professionals so that they can provide quality of care. The IIWCC has been doing that interdisciplinary education of healthcare professionals, physicians, nurses, OTs, PTs, and other allied health professionals since 1999. What we are doing is we are empowering these professionals. We are providing them education, because when you have the knowledge and the skills, you can positively change people's lives.
One of the biggest frustrations where we can make a great improvement is if the patients were looked at more as complex people, and all their complex needs were looked at as opposed to just the wound care aspect of it. The IIWCC course has had a huge impact on Canadian healthcare, I believe.
Since I've done this course and I brought that course to Abu Dhabi, I can tell you that the whole practice or whole landscape has been changed, because the participants who come from all over the Middle East to Abu Dhabi for the same course, when they go back to their own facilities, they have done a lot, because one of their selective is to present what is lacking there in their facility. So they initiated that plan and they implemented it, which really changed the landscape of Middle East.
At this point, 4 years down the line, we have managed to teach doctors, nurses, rehab people from 10 different countries in Africa. We have had just over 100 students that have completed the course, and their impact at this point is to more than 500 million people.
Internationally, we can see how IIWCC made a difference. Over the last few years, since 2006, that we had Iran course, Abu Dhabi, and Saudi Arabia. We trained a couple hundred healthcare professionals in Middle East. Each individual graduated from course were messenger of how a proper wound care can make a difference, and we see that the healthcare system and the wound care approach have been influenced by this educational program.
The truth of the matter, as we see clinically, is wound care patients are very complex. They have multiple comorbidities. There are many, many things we need to take into consideration to help heal people or prevent them from getting wounds. We need the right information. We need the right skills. And what IIWCC is doing is providing, through an innovative, interactive model, that knowledge so that people can provide evidence-based care to enhance the quality of care for people worldwide.
Some students elect to continue their education, taking the Master of Science in Community Health, Prevention, and Wound Care, which combines 3 core pillars of a successful professional practice: wound care expertise, introduction to public health to manage and change systems, and educator courses for knowledge transfer to others. The master's course is offered in Canada, the United Kingdom, and South Africa.
It's a professional master's, which means that it's designed for people who actually work. It can be done, and often is done, on a part-time basis. And there's 2 focuses. One is obviously wound care, but the second focus is how to teach health professionals about wound care, because it's such a new field.
But what was also rich about the master's program is it was 3 prongs. So the first prong was clinical, which obviously in my case was wound care. The second prong was around adult education. So how do we educate others better? How do we make the information usable at the bedside? And then the third prong was health policy.
We've created a lot of learners' policy changes that have happened as a result of the course, and this is necessary to go on as we move in the future. As budgets are tighter, we have to think smarter and really push the patient's best interests forward.
The IIWCC is run annually in Toronto, Ontario, and is accredited by the University of Toronto's Continuing Education and Professional Development Office. Interested parties can learn more about the program and obtain information at woundpedia.com or cawc.net. It is only by learning together and working together that we can build a viable and sustainable wound care system.